A postpartum client's fundus is higher than expected and deviated to the right. What should the nurse suspect? Hi everyone, I'm Beatrice, a registered nurse. Today we are talking about fundal height measurement, an important assessment tool used in maternity nursing. This is a quick but essential skill for nurses and midwives to monitor fetal growth and gestational age. Now I want to mention at this point that ultrasound scan remain the most reliable method of knowing gestational age. So fundal height measurement will give you an estimate. Now in this video, we'll look at purpose of fundal height, some important landmarks, the methods and the techniques used in getting this fundal height, then the findings and some clinical importance or relevance. Now first, the purpose. The purpose of fundal height measurement depends on whether it's before delivery or after delivery. So if it's before delivery, it's simple and straightforward, is to monitor fetal growth and gestational age, to monitor fetal development. Now, after delivery, one of the purposes is to monitor uterine involution. So here we are looking at how the uterus gradually shrink to the non-pregnant state. Next is to assess for postpartum hemorrhage. A soft and bulgy uterus may indicate uterine atony. So you need to quickly massage this uterus, and you can also check maybe the pad to see how many pad is being saturated in an hour to assess for bleeding. Another reason is to ensure that the uterus is firm and midline. So if the uterus is deviated to either the right or deviated, it's not in the midline, it may indicate a full bladder. So this has to be taken care of. So this woman needs to pee or this woman needs to urinate to prevent any risk of bleeding or the weakening, because when the uterus is deviated, there will be no proper contraction. That can lead to bleeding. Also, it can be used to assess the effectiveness of uterotonic therapy, like the use of oxytocin, how effective it is. And finally, it can be used to assess for infection. So let's say the uterus is tender, is very painful, and there's the local that is discharge is foul smelling, has some odor. It could signal infection, and that needs to be taken care of immediately. Next is important landmarks. So for fundal height measurement, the two most important landmarks you need to know is one, the symphysis pubis, and the other one is the fundus, so the top of the uterus. Now for the methods or techniques, we'll be using these two landmarks. We'll be using a tape in centimeters. This tape should not stretch so that we can get an accurate measurement. And this woman first need to empty the bladder and lie in supine position. You can raise the head a little bit and ask them to flex their knee for comfort. While you are also doing this, you're also going to ask them if they feel dizzy. You want to check if they are weak. You want to be sure that the blood pressure is not low. And then you are going to use the tape to measure from the symphysis pubis to the fundus. That vertical line measurement is what we call the fundal height. It should be in centimeters. Now let's look at the findings. So before delivery, at 12 weeks, the fundal height is at the symphysis pubis. At 16 weeks, the fundal height is midway, so it's in between the symphysis pubis and the umbilicus. So at 20 weeks, the fundal height should be around the umbilicus. Now it varies. There are times there may be a difference of 1 or 2 centimeters. Then between 20 weeks to 36 weeks, the fundal height is approximately equal to the gestational age, plus or minus 2. So what I mean, let's say the woman is 24 weeks pregnant. That means the fundal height will be 24 centimeters. So plus or minus 2, some can be less with 2 or more with 2. At 36 weeks, the fundal height is approximately at the Zyphoid process. Now, after 36 weeks, lightening may occur because the baby will try to take the position to adjust for birthing process. So that lightening, there will be a decrease in fundal height. Now, at that point, fundal height measurement may not be that accurate because of that lightening. Now, after delivery, the fundal height will be at the umbilicus. So on that day of delivery, the fundal height should be around the umbilicus. It should be firm, it should be midline. Now, it begins to descend by 1 centimeter or by 1 finger breadth every other day. Now, until day 10 to 14, you may not be able to palpate the fundal height anymore on the abdomen because it should have returned to the pelvic cavity. Now, let's look at clinical importance of fundal height measurement, because there are times this pattern will not follow the way it should be. So let's say for dates, when babies are macrosomal, they are big, or there is the presence of excessive amniotic fluid, like in case of polyhydramnios, or multiple gestation. If a woman is pregnant for more than one babies, the measurement is not going to follow this way. You're going to see the fundal height more than. Now, for small for date, the fundal height may be smaller than normal in cases of, let's say, intrauterine growth retardation or oligohydramnios, where there's less amniotic fluid, or wrong dates where the woman cannot remember maybe her last menstrual cycle. When we measure the fundal height, it may be small, it may be less than the usual or the expected. So that wraps us today's topic on fundal height measurement. If you find this video useful, please like, share, subscribe and leave your comment for more educational videos. Thanks for watching.